Okay. Let's see. So more psychosocial development. So the toddler during this age group learns self-control, but more on a gradual basis. So they kind of go from that egotistic being into a person who starts to understand and respect the rights that other people have, their caregivers. It is something they'd have to learn. So they have to be taught. So their caregivers, their parents, whoever's taking care of them, we kind of have to model these behaviors for them because we're the people who have the most influence on them. So you will see that gradual change from them being pretty self-centered to where they start to think about other people and respond appropriately. A toddler's play is, and we're going to talk a little bit more about play, but usually toddlers do what we call parallel play. So they will play alongside of each other, but not so much with each other. So if you have 4 people at the sandbox, they probably will all be playing with the sand, but not really interacting with each other. So parallel play is typically what we see from the toddlers. And then playtime does involve imitating the people that the child sees as role models. So if you've ever seen little girls and they go, you know, and they dress up in their high heels and they like to play dress up. So they like to imitate what they see other people around them doing. So that's what their main focus of playtime is. So toddlers want and need limits. They need it and they secretly desire it. They just don't know that they do. So when your book talks about discipline and punishment, so discipline and punishment are not the same thing. So whenever we think of discipline, we should think of training or instructing someone to behave a certain way to produce a wanted or a particular behavior pattern. Punishment means that we're penalizing them for someone that's wrongdoing. So I want you guys just to remember that punishment is different than discipline. When we don't set limits for these toddlers, they will develop a feeling of insecurity along with fear. So it's very important that their caregivers guide them. They give them those safe boundaries to make them feel secure. It is shown that with proper guidance that the child will absorb the guidelines that we set for them, and they're going to develop a healthy self-control, and they will also develop a good conscience. Consistency is the key. Always saying what you're going to do, exactly what you say you're going to do, and be consistent each time. That will go a long way. Toddlers, although they do want to be independent, they also require a lot of time, a lot of help during this time as well. So it should always be that whoever's caring for the child, if it's more than one person, that everybody agrees on the same methods of discipline. They should all get together and talk about this. You know, they should all agree on the same rules. And anybody that's caring for the child should care for them just like the other ones do. So they should all kind of have like a strategic plan about what they want for the child, what's important for them, what values they want, and make sure that the parents or the caregivers are explaining that to daycare and anybody else who takes care of the child. Like I said before, this is a very challenging time. That's why they call them the terrible twos. Sometimes they spill over into the terrible threes. Some children never go through this and it's just easy peasy. But some people don't get out of this stage feeling that way. The child does need to learn that the adults are in control. So we want to support them being independent, but we want to keep them safe as well. And we also have to, there are times, obviously, when families are growing and there's a new toddler, when the toddler is getting a new baby brother. So this is also can be another period of time, stressful time for the baby or for the toddler, as well as the parents as well. So it's also shown that sometimes when the baby does come after the baby's born, the toddler, depending on their age, will kind of regress a little bit. So it's common to see them, if they were completely potty trained before, to all of a sudden have accidents at night, or they may have accidents during the day. They might make statements like, I need to be like my brother or my sister. I need to have diapers again. I'm a baby. Some of them may actually ask for bottles, things like that. So seeing that regression when a new sibling arrives is normal, expected behavior. Being able to deal with this the best way is probably being able to prepare the baby or prepare the toddler ahead of time for the baby. So there are sibling classes that they can go to that you can sign the children up to, and you can all three, whoever the caregivers are with the child, go together. And then it's important to use statements like our baby. So instead of the caregiver just saying, this is my baby, when my baby comes, if you say our baby instead, it kind of makes them feel like they're included, and that is their baby as well. Nutrition. So it is important that toddlers get all of the foods from each major food group. The USD guidelines do recommend Choose My Plate. We've talked about that before, and I believe it talks about it in your book. So you guys can go there and see that. Choose My Plate is appropriate for children, recommended by the age of 2 years old. They should be eating table food right now, not really having any supplements unless they have some type of a health issue. It is very common that we see eating problems develop between this age group, 1 and 3 years old. There's a bunch of different reasons why this happens. One is because the child's growth rate has slowed. So we said in the very beginning that this period does slow down. So they might not need as much food as they did before. So it's important that as a nurse that you just explain those things to the patient so that they understand, because as soon as our kids stop eating, we automatically think that something's wrong. So it's important that we educate them and let them know that this is normal, and some children do experience this. Also, that the drive that they have to become independent and be assertive in all aspects of their life also spills over into their eating habits as well. They decide what they eat, they decide when they want to eat it, so that can also cause an issue. And then there's something called food jags, where food jags are where kids just desire only one type of food for like a certain period of time. It might just seem like for every single night they're getting green beans, chicken nuggets, and macaroni and cheese because that's what they like. And usually what happens is, instead of making the child eat what everybody else is eating, because the parents want to see their child eating, they wind up making them what they want, and then it kind of just makes the problem even worse. But so it is common to see these eating issues between this age group, 1 to 3. We should make sure that when they go to daycare and when they're being cared for by other family members, that everyone caring for the child has a good understanding of what their feeding skills are, what they can eat, their likes, their dislikes, things like that. Everybody should kind of like be on the same page with that. With regards to them actually being able to feed themselves. So we know the earlier part of this age group, age 1, things are pretty messy, maybe not even using forks and spoons yet, maybe still using their fingers because that's just the preferred method. It's easier for them. But as they get older and they get a little bit more dexterity with their fingers and their hands, they start to use those forks and those spoons. So it can be messy. So just another thing for parents to understand, because that can also be a little frustrating, and just encourage them to use the fork, use the spoon. Even if they're not great at it first, keep on offering it, put it at the table. Eventually they will get the hang of it. We do see during this phase that they go from finger feeding, so like I said, using the forks and the spoons, and then they are able to use a cup during this time period. Each child, of course, is different. There's really no set time of when that happens, just sometime between. And there's always someone who's going to do it earlier and always someone who's going to do it a little bit later, and that's fine. Keeping these guys safe and healthy is very important. So with regards to health promotion, we want to make sure that they are coming in for their routine checkups. when the baby was born, it was pretty much outlined to them when they come each month, when they need to come again. So it's the parents' responsibility to make sure that they mark on the calendar, know when these checkup times should be, make those appointments. Usually around 15 months of age, they're going to come in for another routine checkup, and they're going to get immunization boosters, and then they'll come in every year after that. So this is a good time when the parents are there with the children. You can do family teaching, talk about accident prevention, things like that. Let's see. All right, so usually by somewhere around that second birthday, maybe a little sooner, maybe a little later, these toddlers will start to have an interest in being able to put their own clothes on. It's going to start out that they just want to help at first, and then it will progress pretty quickly when they realize that they can do it themselves, to them being independent with it and them wanting to do it themselves. They want to pick out their clothes, they want to put their own clothes on. So usually you'll see probably around the 18-month mark, they'll start by taking their shoes and socks off. Sometimes they can get their shirt off. The pants can be, and the shirt can be a little challenging, but definitely they can get those shoes and socks off. Again, this is another one of those behaviors that can be frustrating for parents or caregivers, because as soon as you get them dressed and you sit them down and you go off to do something, they're undressed again. And especially if it's summertime and they're just running around in the diaper goes, everything goes. So it is something you want to educate the parents about, just so they know that it's, that this happens with a lot of children, that it's not just them, and that it will subside. So between 2 and 3, we see them to really start being able to put their stuff on by themselves. So they can put their underwear on, their pants, their shirts, their socks. They might have, definitely are going to have trouble with buttons, zippers, something that needs that, those fine motor skills that aren't quite as developed. But the socks they can do, they can definitely do slip-on shoes, might take them a little bit, but they're starting to do that. Another common theme that we see with this age group is that when they do dress themselves, sometimes it's backwards, because they really don't know, on the right side or frontwards and backwards. They're still learning. But the important thing is that they accomplished it and they did it. So they definitely should be given a lot of praise. Let's see. So when we talk about their teeth, so this is, cavities are a big health problem, not only in our children, but also young adults. So bacteria will form what we call plaque on the teeth when there's any type of sugar in foods that is not washed off or brushed off. So that's why we say we should brush in the morning and at night. Actually, they say 3 times a day, but it can be very hard to do that in kids. By age 2, this is the perfect time for us as caregivers to be able to teach the toddler how to brush his or her own teeth, also brushing the gum where there aren't any teeth. You can do it at night with them, lead by example. And then usually around 2 years old is when they say that they should go for that first visit to the dentist and get that dental checkup, which probably will not consist of anything more than just sitting in the chair and counting the teeth, because like I said, they're pretty scared during this age of strange people. So if you do take them to the dentist, one thing that you can do if they're scared is just have the baby sit in the mom's lap. Usually for doctor's appointments, if they get hurt and they have to go to the hospital and they have to have any work done, or they're just getting their immunizations or just their regular checkup, it always makes them feel better during this age to be able to sit with their parents. It's just gives them peace of mind. All right, so toilet training. So timing has to be right for toilet training. Just because the mom wants to do it doesn't mean that the child wants to do it. So the time has to be right. So usually toilet training can be started when the child's sphincter muscles have developed enough so that the child can actually hold their urine and hold their stool. Once they're able to hold it, then we can start introducing toilet training to them. Usually between the age of 18 and 24 months. Again, there's always that outlier, sometimes sooner, definitely always later is not uncommon. The thing to think about from a caregiver perspective is that we don't want perfection. So we want to encourage them. We want to make them feel comfortable when they're doing it. We never want to scold them for not doing it. When we do put them on the potty chair, they can have a potty chair in the house. You put the child on the potty chair. The book recommends that you just leave them there for a short amount of time. If they have a bowel movement or they urinate after leaving the potty, they don't want you to say anything, because they say sometimes if you make a big deal out of it and then they see you throw it away, that they feel like that they made this, that they did this great thing, but then you went and threw it away, so it wasn't important. So your book actually says that if they have the bowel movement or they urinate in the potty, you ignore it until the child goes away, and then you quietly discard it in the toilet and clean it out. So we don't, like I said, we don't want to tease the child. We don't want to make them sit there until they put something in the potty, obviously. And then we have to understand that even if they are exhibiting good control during the day, night times can be a little hairy for some kids, and it's not uncommon for children to not be fully potty trained at night till upwards of 4 to 5 years, maybe even longer. Some children suffer even longer. So that's not uncommon. All right, sleep. So the toddlers' sleep needs are going to change, not a whole lot, but gradually between these age 1 and 3. So they need about 12 to 14 hours of sleep during their first year, decreasing to about 10 to 12 hours a day by age 3. You'll see as they progress more towards that age 3, they will give up a morning nap, which devastates parents because they look forward to that nap so they can regroup and get some stuff done. But most of them will continue to take that afternoon nap somewhere until the 3rd birthday or even after. Bedtime rituals will definitely provide structure and will make them feel secure. So at night, just an example of a bedside ritual, you can put the child in bed at night with their favorite book, sit in bed with them, read a book, and help them to be able to do something that's either talk or read the book, just some activity that's going to allow them to calm down and kind of unwind from the day before you turn your lights out. Helps them sleep better at night. So we know how busy these guys are and how independent they are and how they want to get into everything and learn everything. So these toddlers definitely need to have constant supervision. They cannot ever be left unattended. Their environment needs to be controlled. So that way, if it's safe and it's controlled, we can encourage that autonomy, but we can also prevent injuries. So accidents are the leading cause of death for children between the ages of 1 and 4. So some important things that we want to think about, we always want to make sure that toddlers should always be secured in a car seat whenever they are in a motor vehicle. So the car seat they have should be appropriate for their age, depending on their weight. It should be facing front or back, whatever your state law says. Adults or caregivers who are caring for the toddler are responsible for teaching the safety about seatbelts. So as you're talking to them, you should always be telling them every time we get in the car, we always make sure that we put our seatbelt on so that way we can travel safely. So we want them to have an understanding of car seats and safety from a very young age. We always want to make sure that the car seat is securely fastened in the car the way that it should be. We always, of course, want to make sure we're paying attention to them whenever they are around motor vehicles, whenever they're in the street, in a parking lot, especially bathtubs, swimming pools. Any family that lives near any type of a body of water, doesn't matter how small it is, can never ever leave an infant that's walking or crawling unattended. It does say in your book that even the smallest amount of water that could just accumulate in a bucket is enough for a small child to drown. Burn accidents is something that we also see. When they start to move around, they can pull chairs up to different, appliances in the kitchen. They can get into the sink and turn the hot water on. They could pull a chair up to the stove while something's cooking and put their hands on there. If they had access to a candle, they could pull the candle out on them. Electrical wires, extension cords, things like that, taking small objects or toys that can fit inside of an outlet also will leave them at risk for developing a burn, being electrocuted, matches, things like that. Also medications, so toxic substance medications, common medications that we see in a lot of households are involved in child poisonings and overdoses. So this is your acetaminophen, laxatives, aspirins, tranquilizers, other types of analgesics like Motrin, antihistamines that we take for colds, cold and cough medicine, and even birth control pills. We also need to definitely do a lot of education with everyone who is a caregiver for the child. If they go to grandma and grandpa's house, which is in their normal environment, the parents or the caregivers definitely kind of want to scope that place out and make sure that it is safe. Especially, you know, we see this in grandparents that don't have small children living at home anymore, or anyone that doesn't have small children living at home anymore. Their house isn't really baby proofed. So these are, you know, you want to educate them about things that can put the child at risk and implement those same safety precautions that you do at home. Okay, so taking care of the toddler in the healthcare facility. So this is outpatient, this is inpatient if they're in the hospital. As a nurse, you always want to make sure that you're keeping in mind their developmental stage. What are they capable of? What are their insecurities? What can we expect from them? So you really need to know their needs and try and anticipate what their needs will be while they are there. If the toddler is hospitalized, like I said before, they're creatures of habit. They like those rituals. This could be very upsetting to them to be in a different place, even if they are with their parents. So you want to try and create that, allow as many rituals in the hospital as you can. So, if they can they get wipe down at night, get a bath, get their pajamas on? Can their caregiver sit in bed with them, read them a book? Whatever their pattern is, we want to try and match that as much as we can to make them feel comfortable. Hospitals and doctor offices really aren't the safest environments for children. So you just have to educate the parents and let them know, that they can certainly explore the area. But they have to be careful because it might not be baby proof. All right. So now we're going to talk about the 3-year-old to 6-year-olds. All right, so according to Erickson, during this stage of growth and development, the major developmental task for this group is initiative versus guilt. So preschoolers will try and find ways to do things to help, but they also will feel guilty if they're scolded when they fail because of inexperience or lack of skill. So if they see you wiping counters down, or if they see you dusting furniture, they're going to want to do it too. So if they go and they do help you, but they miss a few spots, we don't want to point that out to them. We just want to encourage them, give them positive feedback, let them know that they're doing a great job. If you want them to do it a different way, presentation is everything, the way you present it to them. So with physical development, also another period of a kind of like a slow growth rate. The child is going to gain about 3 to 5 pounds each year and grow in height about 2.5 inches. We do see that during this time, their gross and fine motor skills continue to develop very rapidly. By 6 years of age, the child's skull is about 90% of its adult size, and those deciduous teeth have completely emerged. Towards the end of the preschool stage, these teeth are now going to be replaced by permanent teeth. So this is where we start to see them lose teeth. Their visual development is still immature, so their eye-hand coordination is not great. It gets a lot better by that age 6, but still around 3 to 4, still not great. Judgment of distances is not very good either. So this is still that age group where we're seeing them falling. They're going to have a lot of bumps, a lot of bruises, and a lot of falls. Between the age of their 3rd and their 6th birthdays, this is where we see the greatest amount of skeletal growth in the feet and the legs. This contributes to the change that we see from, when they're toddlers, their gait is a little bit wide. They kind of have that little pot belly when they're kind of waddling around. And then as they get closer to this 6 mark, they're taller, they're slimmer, and they actually start to look more like a child, not so much of a toddler anymore. As far as language, we do see a rapid development of their language between ages 3 and 5. Most 3-year-olds can talk in simple sentences. You will notice that when they talk, sometimes they have hesitations as they're forming those words, and they will repeat things because they're trying to search for the right word or to make the right sound. This also we see usually between the 4 and 5-year-olds, sometimes 3-year-olds, if they have older siblings, they will hear a naughty word, or it could be a swear word, things like poop, pee. They get fixated on them, they're fascinated by it, and they want to use it everywhere. Everywhere they shouldn't be. They don't hardly ever use it just sitting at home when nobody's around, but as soon as you take them to school or to daycare, or you're in the middle of a grocery store, that's when they like to spill all these words out. It's exciting for them. We also can see difficulties sometimes, or even delays in language development. So one of the things that we see if children have issues speaking is that they could have a hearing problem. So if you work in an outpatient clinic, or if you're in the hospital and the parent comes in and they say that their child doesn't appear to be talking as much or as well as other children in their age group, one of the things you would want to ask them is, have they ever had their hearing checked, and then schedule that to happen, because language development can go hand in hand with hearing impairment. Certainly other physical issues, but hearing impairment is one of the first things that we like to look at to rule out. All right, so preschoolers have learned very quickly that if they can think about something without actually seeing it. So they can visualize things in their mind, and they can imagine things. So they have a great imagination. This is part of their normal development. Some people refer to it as imaginative thinking. Some people call it magical thinking. But they will sometimes have a difficulty being able to separate between fantasy and reality. They struggle with that. They do believe that words or thoughts can really make things happen. Believing this as a child can have a positive result or a negative result. So, for example, if there's a child that has a younger sibling or an older sibling, and they're playing and they're fighting, and the one child says to the other child, "I wish you were never born," and then God forbid something were happened to the child, they would believe that it was their fault. So they believe that their thoughts, their words can actually make things happen. Because of the overactive imagination that they have, this can also cause fear of the dark at times. It can cause them to have nightmares at night. So this is why we see sleep problems are common in this age group, because of their imagination, and it kind of spills over when they go to bed tonight, and all their fears, when they go to bed at night, and all their fears come about. So I said earlier we were going to talk about the different types of play. So play activities are one way that children can learn. It's just not unsupervised time. We definitely can teach children while we're playing with them. Usually by age 3, we start to see that imitative play, where children pretend to be the mommy, the daddy, or someone else that they know who cares for them every day, or a television character. So the types of play that we can see them engage in are dramatic play, cooperative, associative, parallel, solitary, independent, onlooker, or unoccupied behavior. So dramatic play is going to allow the child to be able to act out situations that are troubling and to be able to control the solution to the problem. So this is important to remember when we're reinforcing teaching with children who are going to be hospitalized. So we can use dolls and puppets to help explain procedures. And then when we use these, it helps the experience to be less threatening for the child. With cooperative play, the child plays in an organized group with other people. So a good example of this is our team sports. Associative play will occur when children play together and they're engaged in a similar activity, but without organization. So there's no rules, no organization, no leader, and each child just does whatever they want or they wish. Parallel play, like we said earlier, children will play alongside of each other, but they play independently. Solitary independent play is when they play apart from others without making an effort to be part of the group or a group activity. Watching television is one form of an example of onlooker play where there's basically just observation without any type of participation. And then with unoccupied behavior, this is where the child could be daydreaming, playing with a toy, just kind of playing with it in their hand, but not really having any type of an apparent purpose to what they're doing. We did talk about temper tantrums. So temper tantrums, we know, are actually a very early form of aggression. So the preschooler may show verbal aggression. They may do this by name calling. Sometimes it's physical aggression, so they can push, they can bite, they can hit, they can smack, all with an attempt to get their way, to manipulate the environment. Is usually why we see them doing this, that physical aggression. So even though this can be something that's very upsetting, obviously, to caregivers, it's important that we educate them and let them know that it is something that we do see normally in this age group. We just have to learn how to handle it and, make sure that we put things into place so that it's not a repeated behavior. We don't want to reward it. We want to let them know that it's not socially acceptable, but we do want the parents to know that it is somewhat common and that other parents experience this as well. And this should be for parents, caregivers, daycare, things like that. Daycares already know how to deal with these issues probably, but caregivers, parents. Let's see. Also during this group, let me go back here a second. So also during this age group, children will start to notice that they are different from other children their age. So if they're doing a school sport, if everybody's doing say volleyball, and everybody plays together and they see how other people play, they may come home and say, Mom, I'm not as good as playing volleyball, or Dad, I'm not as good as playing volleyball as some of the other children. So this is where they start to notice those differences from each other. And sometimes it's not always a good difference and it doesn't make them feel good about themselves. So if parents talk to you about those type of things, it would be good for you to encourage the parent to maybe set up a play date with other friends that includes some type of an activity or a project that that child is good at or successful at, so that way they can build that confidence. So we did say that because this period of time is not a time of rapid growth, they don't require those large quantities of food. They're going to make up for that in a couple more stages. They do need those foods from the major food groups. Protein is always going to be that a high need for them because we're developing, they need that for their muscle growth. We do know that their appetite can be very erratic. One time they might sit down to eat and you might not have enough food. They might have 2 or 3 helpings. The next time they sit down, they might just want a few bites and they're done. So this is a normal behavior. Parents get very upset about this though. My child's not eating, something's wrong. They didn't even eat dinner tonight. What's wrong with them? It's common. It's very, very common. So one of the best things you can do for these parents is just let them know, that, hey, they don't need a lot of nutrition. It's okay if they skip this meal, or it's okay if they only have a couple bites. Usually because of the high energy that they have, it's just hard for them to even sit still sometimes. So usually we can give them several small meals, just kind of like adapting to their behavior, give them several small meals that they may tend to finish, healthier snacks in between. But we do want to try and avoid those snacks that lack any type of nutritional value, because we know they're not good for them. We want to think about the way we're preparing their food, especially if they're saying multiple times, I don't like this, I don't like that. Kids don't usually like highly spiced food, so that's something to think about. Sometimes children may not eat vegetables raw, but they'll eat them cooked, or vice versa. They will not eat them cooked, but they will eat them raw. And then we know that just like we do, children have preferences to the foods that they like. So we should definitely encourage them to try things, but not force them to eat things that they don't like. Some children also like rituals when it comes to their food. So they want to have the same fork, the same knife, they want the same bowl, the cup, they want to eat on their placemat, they want to eat at the same place inside the kitchen or in the living room, wherever you guys, wherever families gather at night to eat, they like that ritual. We do see that there is definitely a pattern where we see that the foods that preschoolers choose are definitely going to be influenced by those people that they live with. So it can be their caregivers. They want to eat the same things that they eat. Obviously, culture and things like that play a big effect into this, into their nutrition, what's at home that's cooked for them. If they sit in school next to somebody else who might eat different things, that could influence them and make them want to try something new. We never want to use food as a reward or a bribe. Back in the older days when I was littler, people used to say, well, if you don't do this, you're going to go to bed without dinner. So that's not something that we ever want to do, because we know that we need nutrition to survive. So never a reward, never a bribe. And we don't want to use it to ever try and manipulate our environment, because kids learn quickly and they will learn to do that. So we know that they require routine checkups. Again, safety is a priority, so we are still reinforcing that good family teaching each time they come in. Things that they're prone to at this age group. They're around more people at this age group, so we're still teaching about safety, car seats, accidents, but also infection prevention, because now they're in school, they're around other children. We need to make sure that preschoolers are up to date with all their immunizations, if they need any boosters. For the MMR, the polio vaccine, the diphtheria, tetanus, pertussis vaccine, and also varicella, that will come between ages 4 to 6 years old. And I did include in here a link, I believe, I posted it online, a CDC link for a chart for immunizations that you guys can look at. We do an annual health examination, obviously for each child, because we want to monitor that growth, monitor that development, make sure that they're on target where they should be, and then we want to screen for any potential problems. We know that this age group does like to view themselves as grown up. They want to have a lot of autonomy and a lot of independence, but they definitely still need to be supervised, especially when it comes to bathing. So the caregiver should still really be in charge of running that bath water. We don't want the temperatures to get too high where they could burn themselves. They do recommend that hot water heaters in homes that have children should be set to no higher than 120 degrees Fahrenheit, obviously to avoid burns. Caregivers should teach children to leave the faucets alone. And usually we allow preschoolers at this age to start washing themselves, but usually with adult supervision to try and, show them the areas they missed or how to, put soap on the sponge. They need to be taught. So they definitely need supervision when they're bathing. Also, when they're toothbrushing, they're probably going to need help with flossing. They don't really have that fine motor dexterity yet. Fluoride supplements should be continued according to whatever the dentist recommends. We do see during this age that they will, that they can definitely dress themselves. That also can be a big issue with preschoolers and parents, because parents will want them to wear this, usually something that matches. They don't really care about that. They just want to dress themselves and they want to pick out their own things. They definitely need to be reminded to wash their hands before and after toileting. With little girls, we always want to make sure that when we're teaching them good hygiene habits, that when they're toilet training, we always teach them to wipe from front to back, never back to front, because the distance from the perineal area to where the urethra is very small. So it would be very easy to get some E. coli bacteria in there, and it could cause a UTI. Another thing we should try and teach them is when they're getting baths, it is advisable to avoid bubble baths because it can cause UTIs, it can cause an infection. Dreams, we talked about that. Nightmares and fear of the dark are very common. We've already talked about that. We know, we talked about burns, poisoning, falls, all common accidents during this time. Preschoolers, it's very easy for them to be a victim of a motor vehicle accident because they're very quick. They don't think, they dart into a street, especially if they're playing with a ball or they're on their bike. They run out in their driveway. They're not, wearing helmets, things like that. So we still should be encouraging families and children, wear the seatbelt, make sure that they're wearing bicycle helmets for safety. It would not be unheard of for a child to fall off of a bike, hit their head on a curb, and have a traumatic brain injury that left them delayed for the rest of their life, if not worse. So definitely bicycle helmets, practicing street safety, make sure that you're, whoever's caring for the child is educating them about street safety so we can prevent those accidents. We want to start, really talking to them about strangers, so stranger danger, not going with people that they don't recognize, what to do. If someone does, your family should have some type of a plan. Talking about fire, you should have a plan in your house with your family members of how you would escape a fire, where are your exits, how would you get there, things like that. And then obviously swimming safety should also be taught. You should, as a caregiver or a parent, you also want to make sure if you do have a pool that you have a ladder that locks, a fence around the pool. You should have all the safety precautions that are necessary. We do see that these children will play with a lot of people in school. They go to daycare, so they play with a lot of different people. They don't always have the best hygiene. They share everything, and infections they share as well. So we just want to do a lot of education with them. We want to teach them to cover their mouth when they're coughing or sneezing inside of their arm, not on their hands, because they cough or sneeze in their hands and then they go and touch things. If they do have a runny nose or they're coughing and they have tissues, you want to teach them how to properly dispose of them. Again, correct wiping after bowel movements, hand washing, not to share cups in school, not to eat after each other, never share toothbrushes, utensils, things like that. And I think I forgot to turn the slide. Sorry, some things never change. I just talked about that. All right, 6 to 10 years old. So according to Erickson, the developmental task of school-age children is industry versus inferiority. So we see that they are now successful in using in activities that use a combination of their motor, their cognitive, and their social skills. They're going to need to develop success using these skills to develop a sense of competency. The health of the school child is no longer the exclusive concern of the family, but is also of the community as well. So we're starting to see a little bit of a shift there. So between this age group, 6 to 10, we see that our physical growth is slow but steady throughout the school years. An average weight gain is about 5 to 6 pounds. Usually by age 7, the child will weigh about 7 times as much as they did in birth. And then we see that height increase over this time period about 2.5 inches. This period does end in that pre-adolescent growth spurt. So in girls, typically, we see it at around 10, and in boys, it's usually around 12, sometimes earlier, sometimes older. There's always that outlier. At about age 6, we see that the children start to lose those deciduous teeth, those baby teeth. Usually it begins with the lower incisors, not everyone, every child is different. At about the same time, we're going to see that first permanent tooth come in. The 6-year-old molars are going to appear directly behind those deciduous molars. By the time they reach the age 10, their spine is going to be straighter, their abdomens are going to be flatter, they're going to generally appear more slender, and they're going to be more long-legged. We will see that bone growth occurs in those long bones of the body, and it's going to be a gradual growth throughout this time period while they're in school. We do see that cartilage is now being replaced by bone at the growth centers at the end of those long bones. So I think we talked a couple classes back about when children have injuries, we want to see if it's affected their growth plate, because whenever there's an injury where there's a growth plate, we know it can affect their growing. So once we see that cartilage being replaced, then we don't worry that much about that. Skeletal maturation is going to be more rapid in girls than boys. So during this age group, they do enjoy doing meaningful projects and seeing them through to completion. So they will put a lot of their energy into play towards accomplishing a certain task, and they will spend numerous sessions on one project. So maybe they like drawing or they like coloring. Instead of them just playing with toys in the room, they may sit and draw for several hours, and they might keep doing it until they, complete their project. If during this age, we have to be very mindful of the goals that we set for the child. So if we set excessive goals that they can't obtain, or any type of unrealistic goal, this can lead to them feeling inferior instead of building their confidence. So that is something we have to be mindful of. Whenever their environmental support is appropriate and they have adequate support, they should complete personality developmental tasks during these years. So they should start developing coping mechanisms. They're going to start to develop that sense between this is right and this is wrong. This is an accepted social behavior. This is how I should conform. This is how I should behave here. This is how I should behave here. And then they're also going to their self-esteem, hopefully positive, is going to start to develop, and they're going to have an ability to start caring for themselves. Not completely 100%, but they're going to show an interest in doing more for themselves. We do know that their family that they're very close to is still a major influence in their decisions and their lives, but now the children that they go to school with and their friends is almost as equally important. So they want to be accepted by their peers and the people they go to school with. They spend a lot of time doing activities with these people. They like team sports, and they really enjoy spending time with people other than their parents. And it's important. They need that. So their cognitive skills are developing. Usually by about the age of 7, they develop the ability to recognize that a change in shape doesn't necessarily mean a change in the amount of mass. This is actually a skill called conversation. So usually we see this around 7. Usually when this starts, it's usually with the conservation of numbers. So an example that your book gives is that a child will understand that the number of cookies on a plate doesn't change even though they're rearranged. So they can start to understand that, hey, there's still the same amount of cookies here, we've just rearranged them. And really before this time, they don't have that cognitive reasoning to be able to do that. Let's see, they also can understand decentration, which is that they can see several aspects of a problem at the same time, and they're actually able to understand the relationships of all those different parts that they're hearing to actually what that whole situation is. And back to the toddler, there was no reasoning with them, so they definitely did not have any decentration. They could only see their side. And then cause and effect relations will become very clear to them during this age. If I don't do my homework, I don't get to play my video game. Cause and effect. So they are able to think in either direction. They can count forwards and backwards, so they can add, they can subtract. This is what we call reversibility. They can also, their thinking, it will include classification. So this is the ability for them to group objects into a hierarchical arrangement, grouping by like some type of a common system. They're able to do that now. This is this age group loves to collect things. So they may have an interest in insects. They might do stamps, coins. I don't know if kids still do that anymore. Yu-Gi-Oh cards, sports cards, anything that they're interested in, they want to collect it. Sometimes you'll see that these collections are a very short-term interest, but some can develop into like a lifelong hobby that they will have forever, but maybe not. So as we see their coordination starts to improve, they become more active. They're obviously going to require more food because they are burning more energy. They need to supply that energy, their energy needs. So also, we should meet their nutritional needs for this age group by choosing all the foods that we talked about from all the food groups. You can use My Plate. They should definitely have the appropriate number of servings that are recommended each day in their diet. They have an increased appetite, and they also, unlike the other age group, have a tendency to go on those food jags. So they might just eat the same thing every single night for the longest period of time. We should allow them to express their food likes and their dislikes. We should also set good examples. So we should model good nutrition habits. We should encourage them to be followed at home and school. So if we're, going to sports and things like that, and we want to bring snacks, we don't want to bring ding dongs, yoo-hoo, Twinkies, things like that. We want to pack fresh fruits, good non-sugar drinks, things like that. So we want to be role models. We do know that obesity and nutrition do kind of go hand in hand, as well as them being able to not be sedentary and to be active. But there are also other things that can contribute to developing obesity. We know our genes also play a role in it, our environment, our role models, sedentary lifestyle, things like that. And then, like I said, we should always allow the child to express their food likes and dislikes. So by the age of 8 to 10, the child is going to be examined for signs of scoliosis. So we've talked about this before. This is that lateral curvature of the spine. I'm not sure if they are still doing this in school. They did it in school for me. They did it in school for my kids. But I'm not sure if they're still doing that today. It used to be in the nurse's office. They would go by last name and the whole school would get examined like over a period of a week. We want to make sure we're doing vision and hearing screenings before they go to school every year, usually during the summer every year. We should make sure they have a well-balanced diet with all the appropriate nutrients, calcium, phosphorus. We want to make sure they're brushing their teeth 3 times a day, eating foods that don't contain sugar at bedtime because we don't want that sugar to sit on the teeth. We want to make sure that we're giving them exercise, but also sufficient rest. So this can be an age group that thinks that they're not little anymore and they don't want to go to bed early, but they still require 10 to 12 hours of sleep a night. This is important for you guys to know. So because they need 10 to 12 hours of sleep at night, they should not be staying up late. So it's important to continue that ritualism. Get that bath at night, have a snack, make sure you have that same bedtime every single night. We do know that substance abuse is a concern, unfortunately, in this age group as well. We also worry about them using or abusing products that can be inhaled. We also want family caregivers to be educated, and we want them to be alert and understand that children in this age group can abuse and use inhalants, deliriants, alcohol, tobacco, vape pens, And you will see this age during school. This is when they will have their assemblies at school and they will start talking to them about substance abuse, avoiding drugs and alcohol, things like that. So as family caregivers, we want them to be role models. They have to make every effort to help develop good relationships with their children. They want to have a strong set of family values. You want to make sure you're setting and enforcing those rules, what's acceptable behavior, what isn't, make them feel loved, make them feel accepted. We want them to learn the facts about drugs and alcohol, so we should be open and honest with them. And then we should listen to our kids. So listen to what they're saying, teach the child, those unhealthy aspects about substance abuse, alcoholism, things like that. All right, so it is very easy for children to find these deliriants in our home. They can just be found in common inhalant products that we keep in our home every day. They might not even realize that children can do anything with them. Sometimes, even though we have them in our home, they might not be using them with the intent to abuse them. They might just be doing it as an innocent prank, but then not realize the consequences that it can have. So some of the things that we see that children can use as these deliriants, we can see that they use model glue, so to put model airplanes, cars, things like that together, rubber cement, different types of cleaning fluids, kerosene vapors, gasoline vapors, lighter fluid. Paint thinner is a big one. They will put paint thinner on a rag and put it into a bag and breathe it in. Varnish, shellac, we use that for wood and projects. Hairspray, nail polish remover, computer keyboard cleaner. So these are all things that we have at home. Even the propellant that we find in whipped cream spray cans, that aerosol that comes out can cause them injury. Spray paint, aerosol spray paint, things like that. So these are all things that we may just have lying around in the garage or somewhere that children could have access to. So parents need to be aware. We want to teach them still at this age group about traffic safety, especially if they're riding a bike or any type of other, like a skateboard, something like that. They should have a helmet on. Seatbelt use, even if they're with their friends now, because remember, they're starting to make friends. They might be driving with other friends' parents. They should definitely know their address, their name, obviously, their phone number, and they should be taught, not to talk to strangers and things like that. Sex education is something that we also see. It will happen in some people's homes. Some parents or caregivers are very open and honest, and they will start having these talks with their children. So it's possible that if your child comes or a child comes from a home where you're not having that conversation, they may come home and say, hey, I talked about this today. What's this? What's that? So parents should be aware that that can happen. Also, we do see at this age where the school sometimes will start to have these talks. They usually send home that form asking permission if it's okay that your child sits in for those lessons in school. And the parents always have the right to opt out. So the changes that we see, so they have an understanding of, a good understanding now of what it means to be born. They've also probably experienced what it means for someone to die. They're noticing that they're noticing their body. They're being a little bit more aware of their health. They're realizing the correlation, or starting to realize the correlation between health and the human body and being healthy. And any illness that they experience as well, all of these are going to help contribute to their view of their own healthcare. So what they've seen, what they've experienced, what their role models are, these are going to help shape their values about how well they're going to take care of themselves. It's important that we understand the concepts that we talked about, obviously in every age group, but in this one as well, so that we can plan the appropriate care for the children of this age group. And then we want to, so these children are getting a little bit older, so their needs are a little bit different. So we want to try and preserve their privacy. They're a little bit older. It's easy for them to get embarrassed. Sometimes they might want to talk separately away from their parents because they're embarrassed. So you want to make sure that you're explaining things to them, and you want to make sure that you're also giving them the privacy that they deserve.
Miss Davis?
Yes.
Marchene says she's trying to get back in.
Okay. Thank you. All right. So 11 to 18. All right. So during this change between 11 and 18, they are starting to mature physically and emotionally. They're growing from being that little child, they're towards being an adult. At least legally, they're 18 years old. They're starting to seek and to understand what it means to be grown up. So they're in a hurry to grow up. So they want to do everything they can. They want to be this grown up. And then they're starting to understand what comes along with being grown up. As they get closer to that age, it becomes apparent that being a grown up isn't all what they thought it was be. So usually in the earlier part of adolescence, pre-adolescence or pubescence, we call it, is going to begin with, we're going to see a huge growth spurt. That's going to signal that puberty is starting for the girls and the boys. So we're talking about their reproductive systems becoming mature. That's what we mean when we say puberty. We see this between age 10 and 12, not always. Sometimes it happens a lot later, 15 to 17. I've seen that happen. So 10 to 12 is that average age, but not always. In pre-adolescence, we see that that child's shaped body that we saw before is now taking on shapes that mimic more of an adult. We have those different curves. We see that in both sexes, those primary sex organs start to enlarge. We're seeing those secondary sexual characteristics appear. Some of the children are getting hair under the arms, in the pubic region, in the legs. And then it's also a time of their hormonal activity is going to be increasing because all these changes are taking place. So this can be a very troublesome time for some kids because they don't understand exactly why it's happening. They know that they feel different. They see that things are happening to them, but they don't exactly understand why. And it can be very scary. So as the nurse, you definitely want to make sure that when you're talking to patients about, if they talk to you about their hormonal changes and what's going on, you just want to let them know that what's going on in their body is normal. Explain to them that what they're experiencing is just hormonal changes. Like, especially with girls, a lot of them will say, I just feel like I want to cry all the time. I don't understand why. I never used to be like this before. So you just want them to know that it's not them, because they already have, some children will have a lot of self-doubt and self-esteem issues to begin with. So it's important that they understand that they're just hormonal changes. It's all part of the growth process. And everybody, during this time period of their age will experience the same thing. The early period is going to end for females in menstruation. So they're going to get their period. And then for men, it's going to be the production of sperm. We're going to see a very rapid growth in their skeletal system, which is going to contribute to them being clumsy sometimes. We do see that in adolescence. They're clumsy and they fall. They're clumsy for a lot of years, it seems like. We see that they're going to have a noticeable physical and emotional change, and they're going to have the knowledge that they are going to be responsible for their own lives soon. The older they get, the more responsibility they get, the more they learn that they're going to start being responsible for themselves. They're working towards being an adult. This is a trying time for them. They have to develop their own personal identities. They have to have a sense of being an independent person away from their parents with their own ideas, their own goals. So this can be very, very hard, very, very hard for parents. They worry about them. They want to try and protect them. They don't want to let them grow the way they should. If parents and caregivers don't give them that independence that they need, then sometimes we see that these adolescents will break the rules. just to prove that they can do things. So it's a tricky time for parents. It's a tricky time for kids. But we do want to encourage those parents to, within safe boundaries, allow them to have their own ideas, at least allow them to have a voice, listen to them, and allow them to make some of their own decisions. All right, so children, like we said, during this period, are going to go through a lot of psychosocial changes before they make it into adulthood. Some of the kids during this period of time will be very fascinated. Sometimes some of them will be very fearful, and some of them will be very confused about everything that's going on in their body. So for some people, it's good. For some people, it's bad. Some people are just confused by the whole thing and they don't know what to think about it. So it's important as a nurse to understand that no two children are probably going to feel the same way. We notice that as they progress towards 18, they're going to begin to look more grown up, but they don't have the judgment or the independence they need to be an adult in society. So those things start to develop a little bit later. Sometimes even, they're fine-tuning themselves by the time they get to be 18. And still it takes a couple years after that before that judgment is in place. They are very, very strongly influenced by their peers. They definitely resent parental authority. They don't want anyone to tell them where to go, what to do, how to do it. They know everything. This can cause a lot of emotional problems for not only the child, but the parents as well, because it's been the parents' job to take care of this child, and they love them, and they've made mistakes in their lives, and they know what things can happen to children. So sometimes parents will hold on a little bit tighter than they should. So it's not easy. I guess that's the thing that I want you to understand is that, each, children and parents have an equally difficult job during this time. And there's no rule book that comes with kids. So, the children need to be supported and advocated for, but also the parents, they need support too. So it's just something to keep in mind. So according to Jean Piaget, the adolescent is going to move from that concrete operational thinking to a more formal operational thought. Erickson's stage of development for the adolescents is going to be referred to as identity versus role confusion. We know that they have a lot of physical and emotional changes. They're working to develop their own identity. They're breaking rules if they have to prove that they're independent. But it is their task during this time to establish his or her own identity and to find their place in society. So they cannot do that if their parents are constantly telling them, this is how you should do it. This is how you should do it. This is the only way. So you want to listen to your kids. You want to give them advice, try to keep them safe. There's a lot of different things that make, we're talking to kids about going to college, things like that. It can be hard. There's a lot of different career opportunities out there for kids. The important thing is that we listen to them, offer ideas, take them to college visits, let them see things that they think they're interested in, to try and give them some kind of idea about going to school after they've graduated for college. So intimacy or mutual sharing of deep feelings with another person occurs when people have developed trust and their own sense of identity. So intimate relationships for adolescents will help in preparing themselves for long-term relationships in the future. It can be very difficult for a parent sometimes because as children develop these relationships with their peers, then their parents will take a back seat, and they get worried. And the first thing they want to do is limit the amount of time that they spend with their peers. But spending time with their peers is very important. They need to establish those relationships, just friendly relationships or intimate relationships, boyfriend, girlfriend, 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 boyfriend, boyfriend, whatever the case may be. They need to develop those in order to prepare for long-term relationships in the future. So you want to try and encourage, one thing that's commonly seen, not all the time with every student, but as students start to become more social and they want to have fun with their friends, they may slack off with their schoolwork, things like that. then parents automatically say, well, I don't know who you're hanging around with, but ever since you started hanging around this person or that person, your schoolwork has, taken a back seat. So now you can't hang around that person anymore. So that's probably not the best way to handle it. You want to encourage those relationships, but you also want to encourage them to do the right thing. So handling it from the perspective of saying, I really want you to be able to hang out with Jake tonight. I know he's a good friend of yours, but this is really important too, because, you have to get good grades or we're not going to get into the college that you want to get into. So just make sure that you're kind of encouraging them. That seems to go a long way. We do know that their body image is extremely closely related to their self-esteem. This is something that our society has a big issue with. Being able to see themselves, their body as attractive and functional is going to contribute to them having a positive self-esteem. During this period of adolescence, there is a big desire not to be different than other people because they are afraid that they're going to get made fun of or that it's not going to be accepted. It's very easily through bullying and negative statements that people will develop negative feelings about their bodies. They can have feelings of inadequacy. So this can be a very difficult time for this age group. Adolescents, particularly more so in the male, with males who feel like they're underdeveloped, will develop anxiety. So there's a big link between self-esteem and anxiety. We see that girls, as they get older, there's this push to have Botox and plastic surgery, breast augmentations, things like that, because they want to feel like they fit in. Obesity is also an issue as well. They don't want to feel like they're too fat. They don't want to appear strange. We want to monitor them and make sure that they're not having any nutritional, any type of a diet that wouldn't be nutritionally sound so that they could fit in with other people. So we really need to watch the things that they're saying and the things that they're doing. It's very hard to be a kid nowadays, and there's a lot of bullying in school and people that just say things that are very mean. So listen to your kids, listen to what they're saying. Just listen. It's an important thing, just to be able to listen. So for pre-adolescent development between ages 10 to 12, we're going to see a very it can be rapid growth or still just that slow continued growth. It just depends. And it can vary between boys and girls. So some children who don't grow fast enough, it can cause self-esteem issues in them because they may feel like they're the smallest one. Other children may point that out and may cause self-esteem issues. Then you have the opposite end of that where children are very tall. So they don't want to be at those opposite ends of the spectrum. But unfortunately, we can't pick and choose how we grow. Girls will grow about 3 inches each year until they get their period. Boys will enter pre-adolescence usually a little bit later than girls, somewhere between 11 and 13, even a little bit lower. A little bit older sometimes. They will, when boys get into this stage, they will start having what we call nocturnal emissions, which is also called wet dreams. Usually this is an indication that that the pre-adolescent period has ended. They need to have information about their changing bodies and their feelings. They need to know because they don't talk a lot about these things with other people, other students, other friends, not all the time. So they need to know from a trusted adult, either the pediatrician, the caregiver, someone in the family. They need to know that what they're experiencing in their body is normal. I did say that schools will offer sex education. That's if the child is allowed to participate in that. They'll talk about hormonal changes that occur and things like that help them, because not everybody has that network at home to educate them about these things. So the adolescent development, this is going to span through the ages of 13 to 18 years old. This is where now we're going to see rapid growth occurring. The skeletal system is going to outpace the muscular system. Adolescents are going to develop a sense of moral judgment and a system of values and beliefs that are going to affect their lives. So they're learning a lot during this time. And then we said earlier, their body image is going to be closely related to self-esteem. So these adolescents do need a balanced diet. They should have servings from every one of the food groups. Again, you can go to My Plate. Appetite increases during periods of rapid growth, so you'll notice that they're eating more. It's important for the adolescent to maintain a well-balanced diet. So we want them to have healthy food choices. We don't want them to have a lot of soda and sugary foods. Their food choices sometimes are not wise, and they obviously are going to be influenced by their peers. So again, we want to make sure at home we're role modeling those good, healthy behaviors. We do see that because their food choices are not always the best, and they are influenced by peers, that sometimes they're deficient in calcium, iron, zinc, vitamins A, D, B, and also folic acid. So they may require supplements. We also know that culture is going to be a big influence on their food choices and their habits and their beliefs. So that's something to keep in mind as the nurse, as is some, which we see a lot of people now that are following a vegetarian diet. So just something to think about as far as supplementation and things that they can be deficient in. So still during this age, they're going to want to make sure they're having those routine physical assessments. We're still at the doctor's office going to be looking at those developmental milestones, making sure they're meeting everything that they should, weighing them, measuring them, making sure they're growing like they should. They're going to be talking now about school problems. Are there any behavior problems? They're going to be looking at that family dynamics, the relationships that they have with family members. All of the immunizations up to this point should be completed. One of the things that they look through later in the adolescent period is the cervical cancer immunization, which is not something that's mandatory for school. It's something that parents can choose to have. A lot of education should be, we should be talking to them about piercings, tattoos as part of that health promotion, about the possibility of getting infections from tattoos. If they do want to get tattoos, they should go to a reputable place, make sure that everything's clean. They should still be having dental checkups every 6 months. They should be getting their teeth cleaned. If they have any type of dental malocclusion, they should see an orthodontist to get braces. We should be talking to them about the tongue piercing. We do see a lot of piercings as they start to get older as well. We know that tongue piercings can damage the teeth. This age group, definitely more than all the other age groups, needs to have privacy. They need to have that individualized attention when they come into the doctor's office. So you will see that that the doctor or the nurse will say, is it okay if we talk in front of your mom? And then if they say no, then they'll take the child in another room and they will continue their conversations there. So you want to maintain confidentiality, and you want to give them the right to participate in their decisions about healthcare because they are almost adults. For female adolescents, they're going to need regular pelvic examinations, pap smears, and you want to teach them to make sure that they are doing breast self-examinations. Now, there's a lot of discussion about when the right time is for a female adolescent to actually start having pelvic examinations. It's not my specialty, so I don't know exactly what the final say is on that. I've heard different primary care providers say that once they start having sex, they should have pap smears then because they can develop certain diseases that can cause cancer. I've heard others say that regardless of sexual orientation, that they should wait till they're 21. So ultimately, they're just going to follow whatever their provider says or whatever they feel like is good for them. Also, we want to teach, just like we're teaching the women to do breast examinations, we want to teach the males how to do testicular self-examinations. And then we also can't forget that our mental health is a very important part of the adolescent's total health assessment. So we want to look at those issues too. So when we talk about different education pieces, so we talked about the jewelry, the tattoos, and preventing infections, things like that. We definitely want to have talks about sexuality, being sexually responsible, sexually transmitted infections, STDs, how to avoid them, about different types of safe contraception, where they can get it at. We also should be talking about mental health issues and substance abuse as well. We do know that this is a very hard age for them. They face a lot of peer pressure. They're developing their own personal values and their beliefs. They have a lot of influence from their peers, from their family members, from society as a whole. They have a lot of decisions to make when it comes to substance abuse, participating in risk-taking behaviors and sexual responsibility. So we just need to recognize as providers, the peer pressure that they have, and make sure that when we have the opportunity, we really educate them about the things that are important and what the actual truths are. Because what they hear from other people may not be the truth. So with this age group in the healthcare facility, because of this age group, they have a lot of fear that they're going to lose control because, now they're independent. Now they're starting to make decisions for themselves. So they don't want to lose any type of control. They don't want to lose any privacy. So we really have to be sensitive to their needs. We want to provide supportive care, and we want to encourage them to participate in their care, and we want to listen to what they have to say. We also want to make sure that we as healthcare providers are demonstrating open communication with the patient. So this is really important, this age group. So we want to make sure that we're showing an interest in them. We want to make sure we're developing a rapport, and we want to ask them questions that will help us build a trusting relationship with them. So if this patient this would be like an inpatient. These examples would be for a child that's inpatient. Usually any type of pediatric ward, whether it's a mental health ward, they usually have some type of teen room or a playroom for them. So if there's during this time period of adolescence, you can encourage them to go to the teen room if it's safe, if you can leave the room, to meet with other patients their age. If they have a computer there, you can encourage computer access there. They can bring their own laptop in. You can encourage them to use their phone, make a phone call, FaceTime, get on Facebook, whatever they want to do. So these are things that are important to them for this age group, and things that we don't want to overlook. And we want to try and make their stay in the healthcare facility as comfortable as possible. All right. I think that is it for this slide. Any questions about the material that we just covered?
It's not a question about what we just covered, but if you're about to start the other one that's on the next test, I don't think we have access to that information, because I tried to look at it, but that exam 3 information isn't available to us yet.
Oh, okay. I can go put it on.
Yeah.
I was going to take a 15-minute break anyway. So we can come back. Well, we'll do a 10-minute break. We can come back at 7:50, and then I'll go on and put that information up so you guys can pull it up.
Thank you.
Okay, you're welcome.